sleep is impaired, and melatonin or barbiturates, all right, may be prescribed to correct the disorder. All right. Now, your book tells you on the bottom of page 267 to see that master the essentials table for descriptions of the most common endocrine system drug classifications. So that's what we're going to go over. I suggest you listen up, make some note cards, be very specific, okay? Um, you're more than likely are probably going to have a matching section on your exam with these medications, okay? So we're going to go over the master the essentials in endocrine medications table here at the bottom of page 267. All right. This table shows the various classes of endocrine medications and the key side effects, the contradictions and the predictions and the interactions and examples of each class. All right. So the first we have class over here on the left, then we have the side effects, then you have the contradictions and the precautions, then you have the interactions, and then you have the examples. All right. So the first class we're going to talk about of medications is something called anabolic steroids, all right? The side effects of taking anabolic steroids are acne, hirsutism, depression, altered libido, edema, glucose, a number of things here, all right? Contradictions and precautions in breast cancer, prostate cancer, pregnancy, number of things here. Make sure you guys are reading this, all right? Interactions with oral anticoagulants, oral hypoglycemic agents, all right? But I do want you to know some examples of these classes of medications, all right? An example of an anabolic steroid is something called oxandrolone, all right? Oxandrolone, okay? The next classification of drugs we have is something called an anti-thyroid drugs. Remember, anti always means against, all right? So, now, an example of an anti-thyroid drug is something called methimazole, okay? Methimazole, okay? It interacts with anticoagulants, okay? There's some contradictions with hypersensitivity. Some side effects of taking methimazole or anti-thyroid drug is headaches, rash, and things like that. Now, the next classification of drug we have on the bottom of page 267 in that Master the Essentials table is something called a cortisol inhibiting medications, all right? These medications, some side effects are dizziness, drowsiness, headache. It's contradicted in pregnancy and breastfeeding patients, all right? The medication example for a cortisol inhibiting medication is called metirapone or METYRAPONE. All right. Now, next page, 268. Still on the Master the Essentials table of medications here. Okay. We're talking about different classifications of endocrine medications. All right. The next class we have is called corticosteroids. All right. Some side effects of corticosteroids are anxiety, decreased wound healing, diarrhea, decreased growth in children, okay? It's contradicted in pregnancy and lactation, all right? There's some interactions between NSAIDs and different vaccines if you're taking corticosteroids. Make sure you inform your doctor. But there is an example of a corticosteroid, and that medication is called hydrocortisone, all right? If you ever have, you can buy that over the counter. We use hydrocortisone for a number of things, okay? Now, another classification of an endocrine medication, I think everyone has heard of this, and if you haven't, you should be looking it up, all right? It's called insulin, all right? Insulin, okay? Insulin, the side effects of insulin can be headaches, increased sweating, irritability, double or blurred vision, okay? There are some contradictions with hypoglycemia, kidney impairment. But I do want you to know some examples of an insulin, okay, of the hormone insulin is called Lispro or Humalog, okay? It gives you numerous examples over there. Make sure you know those things, okay? There's also another classification of drugs called oral anti-diabetic agents, all right? Now, these drugs can Some side effects of oral anti-diabetic agents can be abdominal pain, nausea, vomiting, and a metallic taste. All right. Also, there is a medication in this classification for an oral anti-diabetic agent called chloropropamide. All right. They give you plenty of them over there, but make sure you know, all right, in case you have to match up these classifications of drugs with the name of the actual medication, okay? Then we have something called pancreatic enzymes, okay? Side effects of these class of medications can be nausea, vomit, greasy stools, gas, diarrhea, all right? If there's some contradictions and precautions, all right, if you're allergic to pork, if you're pregnant or lactating, okay? So far, there's no known interactions with taking this classification of drug, all right? But there is a medication that goes with this classification, and it is called pancreolipase, all right? Pancreolipase. Pancreolipase. Probably pronouncing that wrong, but it's there on the bottom of page 268, okay? And then over on page 269, we have the classification of thyroid medications, all right? Some side effects of taking thyroid medications, you could have palpitations, a fast heart rate, irregular heartbeat, increased blood pressure, mood swings, weight loss, diarrhea, okay? There are some interactions with adrenergics, with insulin with these, okay? An example of a thyroid medication, you should know this, is called levothyroxine, okay? Or Synthroid, but levothyroxine will do, okay? Now, coming on down to the bottom of page 269, let's talk about endosystem medications further, all right? Medications used to treat disorders of the endocrine system can be separated into three categories, okay? Three categories. So you'll have medications for thyroid, okay? Then you'll have medications for parathyroid disorders, all right? Medications for pancreatic disorders, and then medications for adrenal disorders, okay? So you'll have medications for thyroid and parathyroid disorders in the three categories, medications for pancreatic disorders, and then medications for adrenal disorders that we're going to go over right now, okay? So, first category, medications for thyroid and parathyroid disorders, all right? The thyroid gland cues our individual cells to work. It's kind of like an on switch for our body. The thyroid has an integral role in our body's metabolism. The thyroid produces two hormones, all right? It's called the T3 hormone, which is the triiodothyron hormone, and then it's the T4 hormone, the thyroxine hormone. So no, the thyroid gland produces those two hormones, your T3 and T4 hormones, okay? And those hormones stimulate every tissue in our body to produce proteins and increase the amount of oxygen that's used by our cells, okay? Now, all right. Coming on down further, okay? Now, therefore, if our thyroid gland is not working properly, we would have less energy, all right? Every cell in our body would be affected, okay? Decreased levels of those two hormones, the T3 and T4 hormones, is an indication of something called hypothyroidism, all right? And if you don't go get that checked out, hypothyroidism can lead to or turn into a skin and tissue disorder that's called myxedema, all right? And myxedema is very difficult to treat, all right? Now, also some more diseases of the thyroid hormone secretion in our utero or our early infancy causes something called creatinism in our infants and in our children, which it is just basically slow brain growth in our children, okay? Also, rapid treatment can prevent both mental retardation and growth retardation, okay? Now, to treat hypothyroidism, patients can take lots of oral doses of these hormones, okay? Now, the medications are prepared from natural sources such as dried porcine thyroid gland, all right? This is, and it can also come from a bunch of these different hormones here, okay? Cytomel, biothyroid, synthroid, levothyroxine, okay? When you're taking these hormones like this, to help treat that hypothyroidism. This is called HRT, or hormone replacement therapy, okay? Because a naturally occurring substance is being replaced, this medication is safe during the use of pregnancy. Also, it's safe during breastfeeding, all right? And it should be always discussed with your doctor, okay? Now, more about hypothyroidism, all right? Hypothyroidism also results from an excess of our thyroid hormone, which can lead to something else called Graves' disease, all right? And this disease, Graves' disease, is characterized by bulging of the eyes, hyperactive metabolism. Sometimes a goiter can appear, which is a big lump there right around our thyroid, there in our neck, and weight loss, okay? Something called a thyroid storm, which is a life-threatening condition and includes such symptoms such as tachycardia, hyperthermia, chest pain, sweating, weakness, heart failure, anxiety, and shortness of breath, and disorientation can also occur. All right. Now, if all those things can occur if the hypothyroidism is if it goes untreated. Okay. Now we're going to turn and we're going to come over to page 270. That was our first category, all right? We talked about the three categories, okay, that are endocrine system medications that, we're talking about the three categories that medications used to treat disorders of our endocrine system can be separated out. And that first category was medications for thyroid and parathyroid. Now, the second category, we're going to talk about medications to treat pancreatic disorders, okay? Now, our pancreas functions properly when it secretes the correct amount of both insulin and glucagon, all right? When this does not happen, the patient may develop one or two serious conditions, all right? The first one is called hyperglycemia, and the second one is called hypoglycemia, all right? Now, everyone should know by now, hyper means up, high, or excessive, and hypo means down, low, all right, beneath. So hyperglycemia results from an excess or increase of glucose or sugar in our blood, all right? This condition can often lead to problems such as wound healing. Your wounds don't heal as quickly, high blood pressure, all right, and nerve damage, among other things, all right? Now, hypoglycemia, down low, is caused by not enough glucose production in our blood, and this can lead to death, dying, dead, you're out of there, okay? Now, if the patient has low blood glucose energy to fuel the cells, then the cells are insufficient, all right? Signs and symptoms of hypoglycemia are restlessness, shaky hands, lethargy, seizures, and coma, okay? Hypoglycemia is normally treated with a small dose of glucose, such as hard candy, but patients may also choose to carry glucose preparations such as Instaglucose or gel, or BD glucose, which is a chewable tablet that they take by mouth at the first sign that they're experiencing hypoglycemia or low blood sugar. All right. If patients cannot tolerate anything by mouth or they're unconscious, all right, they may be given injections such as glucagon, all right, or glucagon, all right. Remember, glucagon injections or glucagon injections are used when a patient is in hypoglycemic or low blood pressure, okay? Now, diabetes mellitus, all right, on the same page, second paragraph of page 270, all right? This is a disease that is characterized by either the hyperglycemia, excessive glucose in our blood, or excessive blood glucose, all right? Diabetes is characterized as either type 1 or type 2. In type 1 diabetes, it's also called IDDM. Make sure you know this. Insulin-dependent diabetes mellitus, all right? Now, insulin in a healthy body serves to move glucose into the body tissues where it is needed and to assist in all the functions at a cellular level. When the insulin is missing from the body, our glucose is elevated in the blood and unavailable to the tissues. All right. When insulin is unavailable to remove accumulating glucose from the bloodstream, cells cells excrete water to flush out the vessels and send the glucose to our kidneys. All right. Now, let's talk about type 2 diabetes on page 271. Okay. In type 2 diabetes, or NIDDM, non-insulin dependent diabetes mellitus, which is opposite of type 1, which is insulin dependent diabetes mellitus, all right, or IDDM. NIDDM patients are resistant, okay? That means that their bodies produce adequate amounts of insulin. However, it does not lower the glucose or the sugar levels as expected. Their body's resistant to it, okay? The pancreas then responds by increasing its production of insulin. Eventually, the pancreas cannot keep up with the body's need for insulin, all right? Genetics, a sedentary lifestyle, and obesity are the main contributing factors for type 2 diabetes, all right? Now, if you look on the same page 271, table 15-15.2, all right, this summarizes type 1 and type 2 diabetes, okay? I suggest you take a look at that. Really, really, really good, and take a good reading of the type 1 and type 2 diabetes, okay? Now, let's talk about types of insulin on page 271. Insulin preparations are divided into 3 categories as well, based on how quickly they start working and the length of action, all right? There's short-acting insulin, there's intermediate-acting insulin, and there's long-acting insulin. Table 15.3, on page 272 on the next page gives you an in-depth look at that, okay? Now, let's talk about them. Break all 3 of those down. Short-acting insulin is usually prescribed on a sliding scale, depending on the assessed blood glucose level. It also can be taken before meals so that it starts to work as your food is being digested. If a patient is allowed nothing by mouth, or NPO, make sure you know NPO means nothing by mouth, for a test, insulin is not given because food is not given, all right? Now, intermediate acting insulin, our second category of insulin preparation, is insulin that is mixed with a substance that makes the body absorb the insulin more slowly. This type of insulin looks cloudy in the bottle, and it must be mixed before it is injected into the patient, all right? And then we have long-acting insulin, okay? This insulin can last up to a day and a half, all right? This insulin usually is taken in the morning or at bedtime. If a patient's diabetes is fairly stable, different categories of insulin can be mixed to cover the next meal and beyond one dose. This is done by the patient or the healthcare worker, or a commercially prepared mixture can be used, all right? The name of the insulin states the ratio of long-acting to short-acting insulin, which the example is 70-30, okay? Now, patients with a history of hypoglycemia or poor control of blood glucose levels may receive insulin through something called an insulin pump. This is a small rectangular device. It delivers insulin at a continuous rate 24 hours a day, 7 days a week, okay? Now, let's come on down to page, at the bottom of page 272, and talk about how we should handle insulin, okay? It's a way to handle the insulin before you inject it into the patient, all right? Or the patient injects it into themselves. Insulin should be refrigerated. Make sure you know that. Insulin should be refrigerated until the vial is open, because refrigeration extends the lifespan or the shelf life for 1 to 2 years, okay, depending on what manufacturer, depending on the manufacturer that produced the insulin, okay? Once the vial is opened, it may be kept at room temperature to avoid painful injections, but it must be discarded within 1 month. no matter if it's open or not, okay? Insulin should never be kept at temperature extremes like freezing extremes or extremely hot. This could, damage the insulin. Always label a container with the time and date that it was open, all right? After you've opened an insulin vial, you need to gently roll it between your fingers like so. Gently roll it if you could see that. Gently roll it between your fingers, okay? But don't shake it, all right? Roll it, all right? Now, injecting the insulin, all right? Rotate the sites of the patient's body when injecting insulin, okay? This is necessary for several reasons. Number one, if a site is used too much or too frequently, the body may develop scar tissue that then in turn it thickens, it gets really thick. Then it prevents the body's ability to absorb the insulin at all, okay? Number two, abscesses may form on that same site that you keep injecting every day, day after day, week after week, month after month, okay? And then most importantly, number three, rotating the sites allows the insulin to be evenly absorbed in the body, and thereby it helps to maintain steady glucose levels, all right, and delay or minimize the complications of diabetes, such as neuropathy, eye, or kidney damage, okay? And it decreases the chance of cardiovascular disease, all right, in our diabetic patient as well, okay? You may need to help your patient develop something called a chart of site rotation, all right? And it shows you that on the next page, on page 273 and figure 15-4, okay? Now, come on over to page 274. Just about done with this lecture here, okay? Now, we're going to talk about, and look at there. Page 274, figure 15-5 gives you a picture of that small rectangular insulin pump that delivers that insulin 24/7 for a patient there, just FYI. All right? Now, the bottom of page 274, medications that treat adrenal disorders, okay? Now, as with the thyroid gland, treatment for adrenal disorders are a response to the secretion of either too much or too little hormones, all right? Now, if too little hormone is secreted, then it must be replaced. And if too much is secreted, it must be controlled before damage is done to the body, before damage is done to the body. So, first we have corticosteroid medications, all right? Glucocortical hormones available as medications are known as corticosteroids because their actions are exactly the same as those of the naturally occurring hormones hydrocortisone and cortisol, all right? Now, chemically, these medications are steroids and are used as replacement therapy when these hormones are absent or diminished, all right? Corticosteroid medications are used to treat something called Addison's disease, all right? Autoimmune disorders, inflammatory reactions, cerebral edema, rhinitis, shock, a number of things here, okay? Now let's talk about what Addison's disease is. This occurs when the adrenal cortex under low suppression secretes glucocorticoid hormones. Patients with Addison's disease suffer from chronic fatigue. They're tired chronically. That eventually worsens. They have muscle weakness, anorexia is a side effect of that, nausea and vomiting, all right, and things like that. Also, there's another disease called Cushing's disease. The adrenal cortex, if it oversecretes if the adrenal cortex oversecretes this hormone, then Cushing's disease could happen, all right? This is when the glucocorticoids, when it oversecretes the glucocorticoids that we talked about earlier. Sorry about that. Patients with Cushing disease have similar symptoms to those of Addison's disease, except these patients suffer hypertension or high blood pressure and hyperglycemia or high glucose levels in your blood, okay, high blood sugar, all right, instead of low tension or low blood pressure, or hypoglycemia, which is low sugar levels in your blood, okay? They also can develop a fatty hump between the shoulders, a fatty hump between the shoulders, okay? Most patients have upper body obesity and a rounded face, and women would have excessive hair growth on their face, chest, abdomen, and thighs. Treatment of Cushing disease is based on the cause of the excessive production, and may include surgery. It could also include chemotherapy as well, and cortisol inhibiting drugs such as metotyrapone or metopyrone. All right. Now, this concludes the Pharm Chapter 15 lecture for the endocrine system medications. Thank you.